The Department of Health has reported a record one-day increase in COVID-19 cases in South Africa. 14,046 new infections were recorded in the last 24-hour cycle. The previous highest one-day total was 13,944, and that was recorded on the 24th of July. In a statement released last night, Health Minister Dr Kerrigan said the virus is spreading much faster than in the first wave. He says government will need to review the current restrictions and consider further measures. The Department of Health has also reported more than 400 new COVID-related deaths, taking the total since the start of the pandemic to 25,657. The cumulative number of cases is now over 954,000. There have been 811,372 confirmed recoveries, and there are currently 117,229 confirmed active cases across South Africa. Right, let's stay on the story. I'm joined by Dr Kerrigan McCarthy. She's a specialist pathologist at the NICD. Good afternoon, Dr McCarthy, and thanks so much for your time on SABC News this afternoon. 14,046 new COVID-19 cases have been identified at a positivity rate of 26%. What does that mean?
So thanks, and good afternoon to you and your listeners. You quite correctly point out that the proportion positivity, that is the number of tests that have tested positive in relation to the number of tests that have been done, is 26%. The proportion positivity is something that we've been watching over time. So in between the first wave and the second wave, we were down to about 7 or 8% positivity. So that means that the proportion of people who tested positive of the total proportion who were tested was 7 or 8%. So the rising proportion positivity means that people who come for testing are more likely to test positive. And that's really an indication of the penetration of this virus into the community and the population. So that people who have symptoms related to COVID, that is fever, headache, loss of taste and smell, cough, symptoms, are more likely to test positive for COVID now than they were 2 or 3 months ago.
All right, so there's concern about the rate at which the new variant of the coronavirus is spreading. Can you explain to us what that new variant is and how it works differently besides this very quick spread that we're seeing?
Right. So all living creatures have DNA or RNA in our genome, in our genes. And every time our cells divide, that gene sequence is copied. And sometimes there are mistakes. And sometimes the mistakes confer an advantage onto the offspring, the daughter cells. And those cells can therefore survive better than cells that didn't have the mistake in the genome transcription or the copying. So viruses, and we know this really from our work in influenza and other molecular biology, that viruses often make mistakes when they copy themselves and replicate. And a new variant has emerged that seems to have taken over the epidemic in South Africa that is different from others. And the big question arises is that the scientists are all grappling with is what is the significance of these genetic changes in the virus? Do they mean that the virus is going to cause a different clinical presentation? Is it going to cause worse illness? Is it going to affect different people? Is it going to spread faster? Now, the emergence of this virus has coincided with our second wave. And that leads some scientists to jump to the conclusion that it must be more transmissible, potentially more virulent, in other words, causes more severe disease. But that has yet to be tested in the literature. So what is apparent is that these changes in the virus are localized to the spike protein, which is the little blob at the end of the spikes on the coronavirus, that we're all very familiar with now. And that is a particularly important area for defense against COVID, because that spike is the area that attaches to the cellular receptor in the human body. And if that spike is blocked by a human antibody, then we can prevent infection. And if people have been exposed and a new variant comes along, the antibodies that were generated during the previous infection may or may not bind so nicely to that spike. Okay. The second thing that may happen is that the variant, the different configuration of the spike as encoded in the changed DNA or RNA of the virus may attach in a stronger way or in a way that allows the virus to enter into the cells better. And also, it may change the way the organism, the virus, survives in droplets in the environment, and so may lead to changes in transmission and changes in the ability to infect people. Now, these are quite sophisticated things to measure because one not only has to look at the big picture, like, for example, the slope of the curve that we see rising up in the number of cases every day, but also we have to do tests in the laboratory to look and see if antibodies from the previous infections, and we have lots of people who've had previous infections, can actually neutralize or stop infection with the new variant. Mm-hmm. Now, the NICD is working together with people like Professor De Oliveira, with the broader NHLS, and with international collaborators, including the UK, who've recently also documented an emergence of a new strain, to answer some of these questions. Unfortunately, these things take time. And so there's only one message that really is of importance and in significance today and now in terms of what does the new variant mean for us as we approach this holiday season. And that is that there is definitely no appreciable change in the kind of things that we need to do to stop ourselves from getting this virus. So the kindest thing that we can do and the most loving thing that we can do over this festive season is really to stay separated from each other physically, not mentally, but to be careful around each other. So to wear masks, to social distance, to sanitize, and to avoid crowded, congested places, and to avoid indoor spaces, and to avoid meeting with people where there are big social gatherings.
All right, with such a high number of infections and deaths, what sort of recommendations may be made to curb the spread? And there's also a question of whether government is taking too long to perhaps implement these measures, seeing that these numbers are so high, as well as that virus or that different variant of the coronavirus being out there?
So there are two important take-home messages. The first is the one that I have mentioned already, and that is the absolute imperative that we have to have as community to social distance, to observe hand washing, mask wearing, avoid gathering together in crowded places. The second message is that because infections will inevitably occur, it is critical that our health services gather their reserves, prepare, plan for extra bed capacity, ensure that oxygen points are ready, ensure that staffing levels are sufficient so that we can cater for the increased case numbers. And it is apparent that all levels of the health system are in the space of preparedness and response, both the private and the public sector, and both provincial and district and hospital services.
There's a sense that behavior changes, as you've spoken about, or staying safe to prevent the spread, may not be changing as much as they need to. We're seeing large amounts of people going home or going on holiday, still gathering. We're seeing across the country gatherings with no masks, music, crowded spaces, exactly what you're saying people shouldn't be doing. Do we have an indication of if people continue with that kind of behavior, how long the virus will be with us? Seeing it's also reported that only about 3 to 6% of South Africans will receive the vaccine next year if it's approved for use and going through other hurdles as well.
Yeah, thanks. It's absolutely clear that this virus is here to stay. But God forbid that it continues at the levels that we are seeing at the moment. And really the only way we can prevent this and the way that is in our hands collectively is to ensure that we minimize social contact, that we avoid gathering in crowded places, that we wear masks. This is particularly difficult for us at this time of year, as it is for any country across the globe. But it is something that we absolutely need to adhere to. In terms of the vaccine, you're absolutely right. It's unlikely that we're going to see large numbers of vaccine available to members of the public over the next few months. And when the vaccine does arrive, healthcare workers will likely be first on the list to receive that vaccine, as they are really on the front line of caring for patients, and many of them are absolutely exhausted now. And it is, So in terms of prevention, messages haven't changed. Our attitudes, our hearts and minds need to be caring for each other at this time, and the best way to care is to observe social distance.
Dr. Kerrigan, I'm not sure if you are going to be able to answer this, but let's stay with the vaccine and what's going to happen. Healthcare workers obviously able to access it. What about elderly people and the rest of the South African population? Do you have an idea of how that vaccine is going to be distributed and what should happen there?
Yeah, thanks. I can't answer the detail of that question, other than to say that government is geared up and has the right structures in place to support both the decision-making around access to vaccines. You are aware that there is a specific ministerial advisory committee dealing with vaccinations. I've no doubt there will be a transparent process in due course around access to vaccines. The second is that government already has a very well defined access route, supply distribution channels for vaccinations as part of our expanded program of immunizations. And there is a specific COVID task team that has been convened with representation from across government sectors in order to prepare and ensure distribution to appropriately qualified persons.
Dr. Kerrigan McCarthy, a specialist pathologist at the NICD, thanks so much for your time this afternoon and the information that you've shared with us, and we really appreciate it.